When someone is diagnosed with high blood pressure, the advice comes almost instantly: cut back on salt. And on the surface, that makes sense. It's simple, it's concrete, and it feels like something you can actually do. But here's where it falls short. For a large number of people, that advice is incomplete at best, and at worst, it points them in entirely the wrong direction. Not because sodium doesn't matter, it does, but because it's only one small piece of a much bigger picture. When you zero in on salt alone, you miss the real reasons blood pressure climbed in the first place. In this video, I want to walk you through the actual causes of high blood pressure that tend to get overlooked, the ones you can genuinely do something about today. And in many cases, once you address these underlying factors, blood pressure comes down on its own, often without the need for medication. We're going to cover nutrient deficiencies, metabolic imbalances, and hormonal drivers. Because once you understand these often ignored forces, it becomes clear why the standard one-size-fits-all approach never really gets to the root of the problem. It's also why so many people end up managing a chronic condition and staying on medications indefinitely. So let's start with why focusing on sodium alone is often not enough and can actually be misleading. Here's how sodium affects blood pressure. It draws water into the bloodstream, which increases blood volume, which then pushes up the pressure inside your arteries. That part is accurate, but what rarely gets explained is what a healthy body does next. If your kidneys are functioning well, they detect that rise in pressure almost immediately and respond by flushing out the excess sodium and water through urine. As that extra volume clears out, blood pressure returns to normal. This system works remarkably well in healthy people, which is exactly why plenty of individuals can eat salty food without ever developing high blood pressure. It also explains why salt sensitivity varies so widely from person to person. Some people are highly sensitive to it, others barely react at all. So when blood pressure stays elevated even after someone cuts back on sodium, that's actually telling you something important. The problem isn't the salt being consumed, it's how the body is handling it. And that's where the real culprits start to emerge. One of the first things I look at is magnesium. Magnesium plays a critical role in blood pressure regulation. It stimulates the production of nitric oxide and prostacyclin, two compounds that help relax and dilate blood vessels. When magnesium is low, blood vessels stay more constricted than they should, making it harder for blood to flow freely, which drives pressure up. The reason I emphasize magnesium is that deficiency is extremely common. Some estimates suggest nearly half of the US population isn't getting enough through diet alone. The observational data backs this up. A meta-analysis of 22 studies found that people with lower magnesium levels had significantly higher odds of developing high blood pressure, and the lower the magnesium, the greater the risk. Why is deficiency so widespread? A big part of it comes down to what most people are eating. Refined grains, sugary foods, and processed products are all low in essential minerals, including magnesium. And a high sugar intake actually causes the body to excrete more magnesium through urine, which compounds the problem. On top of that, even people eating a relatively healthy diet may still come up short, because modern farming depletes minerals from the soil faster than they're replenished. The food looks the same, but it contains measurably less magnesium than it did a few decades ago. My approach is to prioritize magnesium-rich foods first: leafy greens, legumes, nuts, and dairy. But given that even a good diet today delivers less magnesium than it used to, many people genuinely benefit from supplementation. This is worth discussing with your doctor, especially if you have high blood pressure. A recent meta-analysis of 38 randomized controlled trials found that magnesium supplementation at a median dose of 365 millimolars per day for 12 weeks produced small but meaningful reductions in both systolic and diastolic blood pressure. And in people with high blood pressure who were already on medications, the effect was even more pronounced, with systolic pressure dropping by nearly 8 mmHg. Now let's talk about insulin, one of the most underappreciated hormones when it comes to blood pressure. When insulin levels are chronically elevated, the kidneys begin retaining sodium. They essentially stop letting go of it. And when the kidneys hold on to sodium, they hold on to water too, which pushes blood pressure up. This happens regardless of how much sodium a person is eating. It's why people with insulin resistance, prediabetes, or type 2 diabetes so frequently develop high blood pressure. It's also why blood pressure often improves when insulin levels drop, sometimes even before significant weight loss occurs. This is another reason why cutting out processed foods and refined carbohydrates does more for blood pressure than a low-sodium diet alone. Sodium can cause a temporary spike, but it's persistently elevated insulin that turns a short-term fluctuation into a chronic condition. This is also where fructose comes into the picture. Fructose is a simple sugar used as both a sweetener and a preservative in a wide range of processed foods and drinks. I've covered the problems with excess fructose in other videos, particularly around fatty liver. But when it comes to blood pressure, the mechanism works like this. Consuming large amounts of fructose causes the body to produce excess uric acid, and elevated uric acid interferes with nitric oxide production, the compound that keeps blood vessels relaxed. It also makes blood vessels stiffer and makes it significantly harder for the kidneys to excrete sodium. Uric acid is something I routinely check in my patients, especially those with high blood pressure. I've seen many cases where blood pressure normalized simply by reducing fructose intake and bringing uric acid levels down. When diet alone isn't sufficient, we sometimes use a medication called allopurinol, most commonly known for treating gout, but it can also help with blood pressure when uric acid is the driving factor. The bigger point is this: cutting out sugar and processed foods addresses both insulin resistance and elevated uric acid at the same time. Fixing just these two factors can lead to a surprisingly rapid drop in blood pressure, often without traditional blood pressure medications. And this is a theme you'll keep seeing throughout this discussion. High blood pressure is rarely caused by one single thing. More often, it's the result of multiple small physiological stresses that accumulate over time and eventually add up to a significant problem. Another major piece of the puzzle that frequently gets overlooked is potassium. Potassium works in two key areas. First, in the blood vessels and kidneys. It helps blood vessels relax and signals the kidneys to excrete excess sodium through urine. In this way, potassium directly counteracts sodium retention and reduces pressure inside the arteries. Second, potassium acts on the brain. When potassium levels rise, particularly in the cerebrospinal fluid, it dampens sympathetic nervous system activity, which is essentially your fight-or-flight response. That's the system responsible for raising blood pressure under stress. By quieting that signal, potassium helps calm the nervous system and reduces the hormones that would otherwise keep blood pressure elevated. Here's the problem. Modern diets tend to be very low in potassium and very high in sodium, the exact opposite of what supports healthy blood pressure. That imbalance alone can push blood pressure up, even when total sodium intake doesn't look particularly high on paper. And when you layer low potassium on top of high insulin, elevated uric acid, and low magnesium, you've created the ideal conditions for sodium retention and sustained high blood pressure. To get more potassium into your diet, some of my personal favorites are root vegetables like potatoes and sweet potatoes, vine fruits like tomatoes, cucumbers, and eggplant, leafy greens like spinach, and legumes such as chickpeas, beans, and lentils, which also happen to be excellent sources of fiber. And if you've been paying attention, many of these same foods will also help raise your magnesium levels, so you get a double benefit from the same dietary changes. Now, this isn't a comprehensive list of everything that can drive high blood pressure. There are other factors we haven't gotten into: micronutrient deficiencies like vitamin D and B12, elevated homocysteine levels, the role of chronic stress and poor sleep, and secondary hormonal disorders like primary aldosteronism, which actually accounts for somewhere between 8 and 20% of cases of treatment-resistant hypertension. I'll be going deeper on all of those topics in future videos. But the central message is this: address these factors early, before lasting damage sets in. Because once the blood vessels have been under sustained pressure for long enough, once they've stiffened and lost their elasticity, reversing high blood pressure becomes a much harder problem to solve. The window to act is early, and the levers available to you are more powerful than most people realize. I hope this gave you a clearer picture. Take care of yourself, and I'll see you in the next one.